There is a connection between your mouth and your heart that most dentists never explain. A connection that involves a gas produced by specific bacteria living on your tongue. A gas so important to cardiovascular health, blood pressure regulation, and hormonal balance that researchers have been studying it for decades. That gas is called nitric oxide. And what you put in your mouth every single day, including the mouthwash that may be sitting in your bathroom right now, could be directly interfering with your ability to produce it. This video is not about brands. It is not about which product to buy or avoid. It is about understanding a biological chain that connects the health of your mouth to the health of your heart, your blood vessels, and your hormones. And about what peer-reviewed science says regarding how certain oral hygiene habits can silently interrupt that chain without you ever realizing it. Nitric oxide is a signaling molecule produced in multiple locations throughout the human body. In the walls of blood vessels, it acts as a vasodilator. It relaxes the smooth muscle lining of the vessels, allows blood to flow with less resistance, and directly contributes to blood pressure regulation. For women in perimenopause and menopause, this function is especially relevant. The decline in estrogen levels that occurs during this phase of life reduces the capacity of the endothelium, the inner lining of blood vessels, to produce nitric oxide independently. This is partly why cardiovascular risk increases significantly after menopause. It is partly why blood pressure tends to rise. And it is partly why peripheral circulation becomes less efficient. A study published in the Journal of the American College of Cardiology in 2013 demonstrated that endothelial nitric oxide production declines progressively with falling estrogen levels, and that this decline is directly associated with increased cardiovascular event risk in postmenopausal women. What most people do not know is that there is a second pathway for nitric oxide production in the body, and it begins in the mouth. Dark leafy green vegetables, spinach, arugula, beets, celery, are rich in inorganic nitrates. When these nitrates enter the mouth, specific bacteria located on the dorsal surface of the tongue convert them into nitrites. Those nitrites are swallowed, reach the stomach, and in an acidic environment are converted into nitric oxide, which is then absorbed into the bloodstream and exerts its vasodilatory effects throughout the entire body. This pathway was described in detail in a landmark study published in Free Radical Biology and Medicine in 2008, which demonstrated that the conversion of nitrate into nitrite depends entirely on the presence of specific anaerobic bacteria on the tongue. Without these bacteria, the nitrates from vegetables pass through the digestive system without converting into meaningful amounts of nitric oxide. A study published in the same journal in 2016 went further. Participants who used antibacterial mouthwash for just 7 days showed a measurable reduction in salivary nitrite levels and a corresponding increase in resting systolic blood pressure, averaging between 2 and 3.5 millimeters of mercury. When use was discontinued, levels returned to normal within a few days. 2 to 3 millimeters of mercury may sound small, but in a 52-year-old woman with a family history of hypertension in the middle of her menopausal transition, with endothelial nitric oxide production already compromised by falling estrogen, every millimeter matters. The research on the impact of alcohol-containing mouthwashes on bacterial populations of the tongue is more recent and still developing. But the existing data raises questions that deserve serious attention. Ethyl alcohol, even at moderate concentrations, has broad-spectrum antimicrobial properties. When used as a mouthwash, it comes into direct contact with the surface of the tongue, which is precisely where nitrate-reducing bacteria are located. The question is not whether alcohol has an effect on these bacteria. The question is the extent and reversibility of that effect with daily and prolonged use. A study published in Nitric Oxide, Biology and Chemistry in 2015 examined specifically the impact of alcohol-containing mouthwashes on nitrite-producing bacterial populations in the oral cavity. The researchers found significant reductions in these populations among regular users compared to non-users, with a more pronounced effect in individuals with lower baseline oral microbial diversity. Importantly, the same study did not find an equivalent impact from alcohol-free mouthwashes containing diluted essential oils on those same bacterial populations, suggesting that the problematic component is specifically the alcohol, not the plant-derived antimicrobial compounds. If the data on alcohol-containing mouthwashes is still being consolidated, the same cannot be said about chlorhexidine, the most potent oral antiseptic widely available without prescription in many countries. A study published in Free Radical Biology and Medicine in 2019, conducted by researchers at the University of Plymouth in the United Kingdom, performed what remains to this day the most rigorous test of the impact of oral antiseptics on the nitric oxide pathway. Healthy participants were divided into two groups. One used chlorhexidine mouthwash twice daily for 2 weeks. The other used a placebo with no active ingredient. The results were unambiguous. The chlorhexidine group showed a 90% reduction in salivary nitrite levels. Plasma nitrite levels, the circulating form of nitric oxide in the blood, also fell significantly. And systolic blood pressure increased by an average of 2.3 millimeters of mercury in the group using the antiseptic. When use was discontinued, the oral microbiome began to recover, but the process took weeks, not days. Nitrate-reducing bacteria are slow-growing and selective in their colonization. Once eliminated, they do not return immediately. The authors of the study concluded that regular use of potent oral antiseptics may represent an unrecognized cardiovascular risk factor, particularly in already vulnerable populations. Postmenopausal women were explicitly mentioned as a group of concern. The relationship between nitric oxide and hormonal health extends well beyond blood pressure. Nitric oxide plays a direct role in thyroid function regulation. A study published in Thyroid Research in 2011 demonstrated that the synthesis of thyroid hormones depends in part on the availability of nitric oxide in the follicular cells of the thyroid gland. Chronic reductions in nitric oxide production were associated with alterations in the conversion of T4 into T3, the active form of thyroid hormone. For women in perimenopause who already face thyroid fluctuations frequently attributed solely to falling estrogen, this connection represents a variable that is rarely investigated clinically. Nitric oxide also modulates insulin sensitivity. A study published in Diabetes Care in 2016 demonstrated that reduced nitric oxide bioavailability is associated with greater peripheral insulin resistance, a mechanism that contributes to the abdominal fat accumulation characteristic of the menopausal transition. This is not simply a matter of calories and ovarian hormones. The microbial health of the mouth is participating in that equation in ways that conventional medicine has not yet incorporated into routine clinical practice. The integrative approach to oral hygiene does not reject antimicrobial science. It refines it. The goal is not to eliminate bacteria from the mouth. It is to modulate specific populations without compromising the ecosystem that sustains critical systemic functions. In this context, xylitol emerges as the most well-studied agent for this selective modulation. Documented in the Journal of Dental Research across multiple studies spanning 4 decades, xylitol selectively reduces Streptococcus mutans, the bacterium primarily responsible for cavity formation, with no documented impact on the nitrate-reducing bacterial populations of the tongue. It does not kill bacteria. It deprives of nutrients the bacteria that depend on fermentable sugars to survive. The difference in mechanism is fundamental. An agent that kills indiscriminately and an agent that selects through metabolic deprivation produce completely different microbial consequences. For nighttime enamel protection, the moment of greatest tooth vulnerability, when salivary production drops to near zero, a dilute 0.05% sodium fluoride rinse, without alcohol and without broad-spectrum antiseptics, offers documented remineralization without interference in the nitric oxide pathway. Studies published in Carey's research confirm its efficacy in reversing early enamel lesions with consistent nighttime use. Mechanical cleaning, brushing with proper technique, flossing, or using interdental brushes removes pathogenic biofilm with no impact whatsoever on the microbial ecosystem of the tongue. It is the intervention with the best documented ratio of efficacy to absence of systemic side effects. The woman navigating perimenopause or menopause is already facing a reduction in endothelially produced nitric oxide driven by falling estrogen. She already carries greater cardiovascular risk. She may already be managing thyroid fluctuations, increasing insulin resistance, and changes in body composition. In that context, every available nitric oxide production pathway has value. The oral pathway, dependent on tongue bacteria, dietary nitrates, and an intact oral microbiome, is a pathway that can be preserved or compromised by daily oral hygiene choices made without any awareness of the systemic consequences. The science is not saying that one mouthwash rinse will cause a heart attack. It is saying that daily habits that chronically reduce nitric oxide availability in an already vulnerable population represent a variable that deserves attention, and that alternatives with a more favorable systemic safety profile exist and are documented in the literature. This is the conversation that integrative oral health proposes to have. Not from a place of fear, not from a place of prohibition, from a place of understanding the complete system. Because the mouth is not an isolated cavity. It is the entry point of an ecosystem that speaks directly to the heart, to the hormones, and to the metabolic health of every woman. The information presented in this video is intended for educational purposes only and does not constitute medical or dental advice. Always consult your dentist or healthcare provider before making changes to your oral care routine or any aspect of your health.